50% of Americans don't take their medications. And the reasons why are really centered around those social determinants of health. And if we don't tackle that hardcore issue of children, adults, and geriatric patients can't or won't or don't understand why they should take their drugs, we're not going to tackle that 50% number and overcome the unnecessary cost and quality of care issues associated with adherence.
That's the voice of Jason Rose, CEO of Adhere Health, explaining how medication adherence issues cause billions of dollars of medical costs every year. You're listening to How I Transform This, presented by Versus 12. Versus 12 is the award-winning Salesforce Gold consulting partner focused on healthcare innovation nationwide. In this episode, Jason shares about the work Adhere Health is doing to improve healthcare outcomes by helping patients and clinicians understand the issues around medication adherence. He also explains how a continued focus on adherence could serve the healthcare system during COVID-19.
If the patients that are at most risk actually were taking their medications as prescribed and as they should per evidence-based guidelines, we would actually put a major dent into the mortality of these patients.
I'm your host, Clark Buckner, and along with Versus 12 founder and CEO Tammy Hawes, each episode, we're seeking out healthcare technology industry leaders, exploring stories of success through the transformation of healthcare. For more stories like this, visit versus12.com/podcast. Now let's jump in.
Hi, I'm Jason Rose. I'm the CEO of Adhere Health, where corporate headquarters are in Greater Nashville, Tennessee, and we have about 1,000 employees across the country.
Jason, thank you so much for joining us on How I Transform This. We're really excited to have you.
Thank you.
Yeah.
Looking forward to it.
Yeah, thanks, Jason. This has been a long time coming. I'm so excited to have you on the show today and can't wait to hear about all the great things you guys are doing at Adhere.
Great. Thank you, Tammy. Thank you, Clark. I appreciate the opportunity.
One of the many reasons I love the show is it gives me a chance to kind of connect with so many of the friends and colleagues that Tammy has, but she just knows everybody, and we get to sit down and hear some really interesting examples and real stories on how companies in healthcare tech are driving transformation. And right now, the last couple episodes we've had, I mean, no surprise, they've been about how this world is changing so quickly right now with COVID-19, so many things that are demanding fast change. And Tammy has talked all along about so many items, like telehealth and so many things that now we're seeing they get forced to change. It's been really insightful to get to talk with several different CEOs like yourself who are on the front lines of all this. So what we'd like to start with, just really briefly, as we're learning more about you, how did you get involved with healthcare? And then let's go and talk about Adhere.
Sure, absolutely, Clark. So I've been in healthcare technology my entire career. If you were to go way back into the 90s, when I was in graduate school at George Washington University, I was enrolled in the business school's health services administration program. And as I was looking at the different options and concentration of what I could focus my coursework on, there was really nothing there in terms of technology. There was hospital care, managed care, regulatory, nothing on technology. So I went to the dean of the school and suggested that technology could make a major imprint in the overall outcomes of healthcare and the efficiency of healthcare. And I asked for the ability to create a track concentration in technology. So I created coursework and curriculum, got it approved by the dean of the business school, and became the first or one of the first technology concentrations in healthcare for the school. So over the last 25, 30 years now, I've dedicated my entire career on how we can leverage technology and analytics to drive and enable improved outcomes in healthcare.
That is fascinating. So you were transformational in healthcare before you even went into the workforce.
Yeah, it was, before there was a healthcare tech. I was in the healthcare tech and, started I was you're speaking to the first, and maybe the only graduate intern of Cerner Corporation. So one of the largest EHR companies in the world. And I somehow convinced them to create a internship program for me as a part of my coursework, and I had a great experience at Cerner, and eventually they hired me, and spent first, call it 10 or 15 years really in technology management, and eventually had the opportunity to get into product development and working with the sales and marketing, and have evolved over the last 15 years to become a CEO. And it's been always technology focused. I always look at process as the most important aspect of really any business, and how can you improve or make more effective those processes with technology, and then what people do you need to enable those or realize those outcomes.
So Jason, Versus 12 was working with PharmMD. That's the name of the company before it went to Adhere Healthcare. And so we know a little bit about what you guys were doing back then with medication adherence. Give us a real overview of where you guys are now, and how you've transformed over the past, I'd say, 3 or 4 years, and specifically since you've been CEO of the organization.
Yeah, thanks, Tammy. I appreciate the opportunity. So we changed our name from PharmMD to Adhere Health in March of last year. And I joined the company in the prior year. So I've been there about just over 2 years. March of 18 was my start date here with Adhere. And the company really has transformed itself over the last 2+ years, really focusing on the vision of the medication adherence problem in the United States, and certainly that could go across the world. So just in the United States alone, every year there is $500 billion of unnecessary medical costs associated with medication adherence issues. And this isn't my study. This is actually a study by the research out there that shows that it's an average of $500 billion every year that is associated with medication adherence issues. These are patients that are not taking their drugs at all when they first are diagnosed with issues and prescribed medications, not taking their medications per evidence-based guidelines, and maybe not discontinuing drugs when they should. If they have a hospital discharge event or some major medical event and they don't change their medications and stop taking the ones that they should stop taking. And that is the essence of how we rebranded our company to become Adhere Health, a much broader vision in terms of adherence, and how both the federal, state, private, public partnerships, such as Medicare Advantage reimbursement for star ratings, or star ratings for readmissions for hospitals and nursing homes, and as well as for the overall reduction of medical costs with the rising costs of premiums. We really thought that the brand name changed from PharmMD to a more broader outlook of Adhere Health was important. And that goes along with becoming more of a technology-focused company. So selling software as a service, leveraging what was our internally used platform for data analytics and clinical workflow to be leverageable for our end users across the country, health plans and providers and pharmacies, to leverage a platform to drive outcomes for patient care.
Before we get to where we're at today in the world, and how things have been changing and challenged in new ways, anything else you can share with us just that we need to know right now of through these changes that you've made? I know Tammy was already familiar with the previous name, but today, what is different about the Adhere Health platform? Anything else we need to know before we move on?
Lots of things are different. We've completely transformed the company. We have certainly homage to the founding of the actual company itself, which, if you don't mind, I'd like to just take a moment to speak about it. I think it's important. So our company was founded by Clayton McWhorter, who in Nashville is extremely well recognized as former CEO of HCA, largest for-profit hospital company in the United States, as well as philanthropist known for philanthropic events and dozens of companies that he's founded over the course of his lifetime. He passed away about 3 years ago. I never personally had the opportunity to meet him myself, but the story in terms of his legacy and how our company was founded is really, really interesting. Clayton was actually a pharmacist, and he also had an older brother named Fred, who was also a pharmacist. And they both grew up evidently very poor. And when they both kind of went about their ways in terms of building out their respective careers, Clayton going into obviously hospital management, eventually into doing entrepreneurial areas of business development and creating new companies. His older brother, Fred, started a bunch of retail pharmacies in rural Tennessee. And over the course of his life, I think they were both very successful. Fred decided to start selling off his pharmacies to the big box stores, so to speak, pharmacies. But what was interesting thing that happened was those patients that he used to serve started coming back to him and asking him if he could buy the pharmacies back from who he sold them to. And he asked them why they were having these issues. And the problem was that they had lost their connection with their community pharmacist, and they had lost their ability to really have a meaningful conversation about problems they were having with the drugs that they were prescribed, or issues with affording them, where they were making them feel sick, or not understanding from a literacy perspective why they were taking them. And today we call those social determinants of health, SDOH. It's I like to call it as Maslow's hierarchy of needs in healthcare: food, water, shelter, access to care, understanding why they're taking drugs. And so evidently for years, Fred would talk to Clayton about why it's important for all these companies that he's creating. He should create a company focusing on medication adherence. And unfortunately, in 2005, Fred got sick and he went to the hospital and sadly died, ironically, of a medication error in the hospital. Before he passed away, he spoke to Clayton and made him promise him that he would start a company focusing on medication adherence and help other people avoid problems, whether it be medication errors or other complications of medication adherence. And about 6 months later, in June of 2006, Clayton founded the company PharmMD. And so we really take that very personally as a company, as a founding, with respect to how we use our origins, and what we're doing is really important. So we start every board meeting, every employee town hall, every quarterly business review with our clients, and it's littered across our website of individual stories. We call them consumer success stories, individual stories about how we're able to improve their overall health through medication adherence, reducing medical costs through avoidable surgeries, avoidable hospital admissions and ER admissions, and unfortunately mortality. And then we take that qualitative story and translate it to a quantitative outcome for population level. And so we take that higher level of purpose of how medication adherence can really drive outcomes. We translate that into, I'll say bits and bytes, analytics. So on a daily basis, we're receiving data from our partners. I would say today, typically managed care organizations. So we work with about 30 million consumers on an annual basis, leveraging the data, medical data, pharmacy data, hospital discharge data, eligibility data, other factors from managed care organizations. And we identify gaps in pharmacy, gaps in the medical data that they have, diagnoses that haven't been prescribed properly, or patients that are not taking their drugs adherently or discontinuing as they should based on evidence-based guidelines. And we translate those analytics daily into a clinical workflow software platform, and either use our clinicians, which we have about 1,000 of licensed clinicians across the United States, to reach out to those patients to discuss challenges they're having with these drugs and overcome them to close those gaps, and also with their doctors to represent the broader issues that the patients are having with these particular drugs that they should be taking. And that is how we drive value into the system. And we put our money where our mouth is, and we only get paid when we are successfully converting patients to be more adherent, and leveraging our software platform as well for clinician and users across the country to drive the same sort of outcomes.
Jason, that's an amazing story and an example of how a company with a mission, and a company that propagates that mission throughout the organization and allows employees to know why they're working can make a huge difference. So thanks for sharing that.
Yeah, absolutely.
It really brings it to life, the mission, and that recentering. It makes so much sense, especially when earlier you shared with us that quote, process is the most important part of any business. And what better way to simplify and refocus, especially in these times when the company was making some changes. And in order to do more, I feel like you have to do less at first.
Yeah, there's Clark, there's a lot of companies out there that focus on, I'd say, the peripheral areas of outcomes improvement, whether it be smart pills that you swallow and you can somehow track. That company just went bankrupt about 2 weeks ago, or Bluetooth enabled pill bottles and things of that nature. It's really not getting at the heart of it, is that 50% of Americans don't take their medications. And the reasons why are really centered around those social determinants of health. And if we don't tackle that hardcore issue of children, adults, and geriatric patients can't or won't or don't understand why they should take their drugs, we're not going to tackle that 50% number and overcome the unnecessary cost and quality of care issues associated with adherence. And that's why we take the approach we do, is real-time data, working through the life issues that these patients have to overcome these problems, and using technology and analytics from a process standpoint, and using clinicians that are licensed and experts in diabetic education or pharmacists or things of that nature to overcome these issues is, I think, the real challenge that we are seeking to overcome. And I think that we're unique in that standpoint.
Jason, you obviously understand how you can provide technology to your clients that is truly transformational as it relates to medication adherence. But you're also a proponent of technology internally to drive your own business processes to make you more efficient. So tell us a little bit about that as well.
Yeah, absolutely. Just yesterday, I was having a conversation with our chief information officer. We are a hyper growth company. So we have, just to give you a couple numbers of indication. So our revenue has multiplied by 10 times since I joined the company about 2 years ago, and our employee base is also multiplied by 10 times. So we were about 1,000 people now. When I joined the company, we had around 100 people. So when you have that type of growth, and frankly, those create problems, those create other opportunities. They're good problems to have when you have high growth, but you still have problems. And the answer can't be, we'll get around to it, or we need to add more people. It has to be, we have process, what we do internally, because that is what we are selling externally. So everything we do internally is based in process, written down process, and leveraging technology internally, whether it be our business analytics platform, we use Microsoft Power BI, or our Salesforce customer relationship management tool that we leverage to go to market with, integrated with best-in-class marketing platforms that drive that customer relationship and drive growth from process. Those are the types of base level tools that we use internally and really drive from a metrics perspective and KPIs of how we're actually performing. Because if we're going to go to market and sell these awesome platforms that drive healthcare improvement, then we really need to be operating in the same way internally. Otherwise, I believe it's just fake. So we really strive to leverage process and tech in that same way.
I love that.
So when you think about these processes, because you got to have great processes if you're going to be selling processes. So you mentioned some of the tools you were using. Is there anything that has especially worked well that you would maybe share with other healthcare CEOs or other healthcare leaders that has worked well for your business? So you're getting the internal aspects working better so you can be more effective to your customers.
When I joined the company, our sales team, we didn't have a marketing team. We had literally 0 people in marketing, and we didn't have much of a sales team. We had a Salesforce administrative person, and we had 1 sales executive. When we experienced this tremendous opportunity for growth, we saw, I sold to our private equity firm that we really had a massive opportunity from a TAM perspective, that's total addressable market, taking our solutions, and if we were to proliferate those solutions to clients across the country, what would be the total addressable market that we could achieve with selling those products? When we did that, we also included, these are the types of people we would need to hire, people such as sales development resources for lead generation, marketing teams, more salespeople, solution engineers. What tools will we need? We need a best-in-class marketing platform. We need a best-in-class CRM tool. That was a no-brainer. We already had Salesforce. We just needed to put more investment into Salesforce. And we needed to integrate the marketing with the Salesforce and then those tools into our processes, along with enabling the people to really leverage these tools. So today, what we have with respect to our marketing and our CRM system with Salesforce is that we have, I think, nearly 100,000 contacts, which is probably 40x of what we had about 2 years ago. And we have a very clean set of contacts in the system that gets updated on a daily basis. We leverage those contacts into our marketing platform to send out lead generation emails to talk about thought leadership. We never sell necessarily what we're doing. We want to talk about thought leadership in terms of what we're aspiring to do. I always like to say mission-focused marketing, because we're putting our mission on our sleeve. That is how we market. We're focusing on medication adherence that drives outcomes. And then we use that marketing engine to broadly get the messaging out through blogging and through emails and through webinars and things of that nature. And then those marketing qualified leads translate into the sales development resources, so they can call and reach out to the individual targeted contacts that we have built into Salesforce to identify whether or not we have some interest in some of our products. We've gone from, I'd say, maybe 2 or 3 products that we sell back 2 years ago to about 20 to 25 now. That's one of the reasons why we have this great growth, leveraging that kernel of medication adherence. So it really depends on how a particular customer, in our case, mostly health plans, how they see their current organization and what is interesting to them in terms of having a larger discussion. So all of our processes that I'm describing are all built into Salesforce into different stages. We have 5 stages, and they have exit criteria on each stage to make sure that we don't have a sales team that is not being honest with themselves. Not that salespeople are overly optimistic sometimes, but ensuring that we are using structure and process in the CRM tool in Salesforce to show the client opportunity. This has checked off these boxes, so to speak, to move to the next stage. And that way it gives us better forecasting in terms of pipeline, a more realistic perspective on how we are advancing different growth opportunities. All these numbers are measured on a weekly basis intimately, and we have a much better tool in terms of forecasting that I can elevate to my board, my private equity team, so that we can show the results that are coming forth. And that's just one example of many that we're using process and technology and making sure that people are using those tools.
So, Jason, what you just described not only requires a heavy lift on technology, it is truly transformational from a change management standpoint and getting people to adopt the new processes and the new technology. So kudos to you for leading the organization through that. It's an amazing story.
Yeah, when we sell our software to our clients, when it's a software as a service platform, we're changing their internal processes. So enabling our solution engineers to identify current state and what the future state may be, and configuration to our platform to adopt into the goals and benchmarks that they were trying to achieve is very much a part of how we go to market. It's the same exact thing is necessary when we're the buyer, so to speak, and we need to make sure that we have the right tools and configuration and training and change management with our own internal team, whether it be our analytics organization, which was a massive transformation as well, or our CRM transformation. So we've grown our sales team from, I think it was like 3 or 4 people to 35 or 40 now in that 2-year time frame. So really, if we didn't have a strong process and structure and technology tools to leverage the opportunity in terms of what we saw in terms of growth, then we would have had a lot of wasted effort. So really, that change management is really critically important.
That was fantastic. Yeah, thanks for sharing that.
This has all been really helpful to hear, and I love how you're not only giving us a really great zoomed out perspective, but you're really zooming it in to see what you all been doing, what's been working, how you've been able to grow your processes to help more people. So one of the things we definitely wanted to talk with you about today is the world we're in right now with COVID-19, and that's been a common, set of dialogue we've been having with several recent guests on the show. And earlier you were talking a little about, 50% of Americans don't take their medicine. You were talking with us a little about some of the social determinants in health that are a real factor, also layered on top of that. Now we've got COVID-19. So how are you doing now to support these patients through COVID-19? And how is that maybe demanding more change or transformation from the industry? We'd just love to hear some of your thoughts on this right now.
Yeah, that's a really great question. I wrote a blog, actually, it's on the healthcare blog about this a couple of months back. So all those issues that we discussed a few minutes ago, where patients are already not taking their drugs and there's issues in why they're not taking them, they've just been exacerbated with COVID. So the CDC put out a report, Centers for Disease Control put out a report a couple of months ago that showed that 90% of hospitalizations have patients that have underlying conditions, and 75% of those patients that are being hospitalized are elderly. So those are the exact same patients that are causing the $500 billion of unnecessary medical costs before COVID. Now it's just been exacerbated to being worse. So the perspective that we have is that if the patients that are at most risk actually were taking their medications as prescribed and as they should per evidence-based guidelines, we would actually put a major dent into the mortality of these patients. You look at the social determinants of health, we're starting to see this, and finally, a few months late, in terms of the newspapers and the media, et cetera, where in the government are starting to say how we need to focus the attention on those who are most at risk. And those are those same people, elderly and people with underlying conditions. How do you best treat them and protect them? Obviously, social distancing, wearing masks, washing your hands, and things of that nature. But if they took their medications, we would actually put a major dent into the actual spread of the disease in terms of moving along the path into mortality and things of that nature. And we are very well positioned, obviously, as a company to help with that. All of our clinicians, we have all licensed clinicians, we have nearly 1,000 of them. They're actually all working from home. So you think about process. So when we decided to close our corporate headquarters in early March, we were one of the first offices in Nashville to close. It was very easy for us to move home, our 110, 120 people out of our corporate office, into working from home, because our workforce was already working from home and always have been on our technology platform, on recorded phone lines. And so process-wise, it was a piece of cake. We didn't miss a beat. And since then, we've added about 400 people to our team since COVID hit to address this continuing problem and demand that we have been meeting in terms of helping patients improve their overall health through medication adherence. So what we're seeing now is the word is getting out, so to speak, in terms of patients really need to take their medications to prevent being hospitalized. They're best served to stay home unless they're very sick in terms of acute issues. And so we don't want them going to a local pharmacy where they could have impact. We would like for them to be able to leverage telehealth and things of that nature. And we really need to make sure they take their drugs. So with our company, we uniquely leverage our technology to identify these patients. And then on our platform, we call it the Adhere platform, we have a number of different pharmacies on the platform. So we have national-based companies that you're very familiar with. I won't speak to names of them here, whether it be a mail order or dosage or compliance packaging companies are on the platform. And we also own our own pharmacy, which we call it Adhere RX, which focuses on the most sickest of the sick patients. These patients on that kind of right end of the scale that are at most at high risk, even before COVID and certainly after COVID, average 6 to 7 drugs a day. They often are immobile, they're age blind, disabled. They can't necessarily even get to the mailbox to go get their prescriptions, and they really need a monthly discussion with a pharmacist. So what we do is when we identify patients that have these kinds of needs, we offer different pharmacy options that the health plan has in their benefits package. One of them happens to be our pharmacy at HereRx. The patient chooses our pharmacy. We're private couriering the drugs on a monthly basis to the patient's door. We take cash on delivery. For those patients who don't have credit cards and don't have the financial means to pay timely, we can space out payments. And then we set up a monthly regimen of phone calls to ensure the patients are taking the drugs correctly. And those are the types of real world meaty issues that we believe is really important to move the dial, whether it be COVID or post-COVID issues. It really will move the dial in terms of adherence and outcomes.
That's amazing. And so along with your high-tech pharmacy at HereRx, I know you have a master plan of what you're going to be doing in the next 5 years and how Adhere Health may be transforming and growing. Tell us about your expansion plans for the future. What do you envision?
Well, there is a very large amount of opportunity for us. We will continue to expand with Medicare Advantage star ratings and state-based value-based reimbursement with Medicaid and the ACA. We have recently expanded, I always like to call it Back to the Future. Our company focused on self-insured employers back in 2006, and we have now taken that same direct-to-employer product offering and expanded into the commercial managed care space because they have obviously hundreds of millions of patients that are being administered by managed care and TPA. So we've taken that same direct-to-employer product into the commercial space. So we expect to see a lot more opportunity there. There are about 70 million Medicaid patients that are having an extensive amount of social determinants of health issues. So we are really putting a lot of emphasis into the Medicaid space. For example, we did add a Greater Phoenix pharmacy to support our West Coast clients. About 2 or 3 weeks ago, we opened up that very high-tech robotics automation pharmacy. But we also plan to build satellite pharmacies across the United States as well to really put these smaller satellite pharmacies, call it 2,000-3,000 square feet pharmacies that on a daily basis will getting shipments from prepackaged pharmacy bags for each of these patients from the larger facilities in Cary, North Carolina and Phoenix, sending them to the brick and mortar pharmacies and located in the most impoverished areas of the country. And then where there are same day service needs of urgent care, we will be able to have same day pharmacy distribution through private courier to those patients through our more local hubs, so to speak. So that is something coming to a theater near you very soon. As of probably 2020, I think we'll have at least 1 or 2 of those set up. And that is really different. Having the access for these Medicaid patients with same day service, think about Amazon, who does that same day service or next day service. It's a great model. It's just no one's doing that for pharmacy. It's just not something available. And there's a lot of tech and a lot of clinical subject matter expertise that you need in order to accomplish that. But that's one of the areas that we're tackling.
As I'm hearing your story, I think that most often in healthcare, we as an industry say that, it can't be done, it's too hard, it can't be changed. And in hearing your story, I'm seeing that Adhere Health is really an example for other healthcare companies that transformation really can occur with the right strategy and, more importantly, even the right execution. Because it's amazing what you guys have done in the last year or 2 years.
Jason, this has been so great. I hope we can at some point do a follow-up. And I know you all are doing such important work, and especially right now with what the world is facing with COVID-19. And it's clear that your team is ready and you've been ready to go up against something like this. So thanks for sharing how you've been driving transformation. And I'm really excited to hear more in the future.
There's an old Winston Churchill quote, which is never let a crisis go to waste. And there is a crisis in the really not just the United States, but across the world with patients not taking their medications adherently. And there is an opportunity right now that we believe as Adhere Health that we need to be on the front lines. And this is why we're working so hard, harder than ever, to really be a part of that solution for COVID, because we really truly believe that we can put a dent permanently into unnecessary costs of care and quality issues through medication adherence.
Yes, thanks, Jason. We really heard all kinds of great nuggets of advice that all of us in healthcare can use. And we're, as Clark said, excited to see the future.
Thank you both.
Thanks for listening to How I Transform This, Success Stories of Transformation in Healthcare, presented by Versus 12. To learn more about how Versus 12 is best situated to transform the healthcare industry and to follow along with this show, be sure to visit versus12.com/podcast. We'll see you next time. Best situated to transform the healthcare industry and to follow along with this show, be sure to visit versus12.com/podcast. We'll see you next time.